Hello, everyone. Welcome back to my channel today. Thank you for tuning in. I am Chioma Leo, and today I'll be discussing febrile convulsion. Febrile convulsion. Of course, when you are talking about convulsion, it's a kind of medical event that is characterized by involuntary muscle contractions that could result to loss of consciousness or partial loss of consciousness, twitching or jerking, uh, some movements also like stiffening as well that happen to a person. So, and there are several causes of convulsion, but today we are going to be focusing on the one that is caused by high fever or fever, let's say, or a sudden rise in fever, and that is what is called febrile convulsion. Febrile convulsion is such convulsion that happens because of a spike or a sudden rise in temperature. And this febrile convulsion is common in children between the ages of 6 months and 5 years. Now, it is important that you should know that not every child who is running a fever or a temperature will come down with convulsion. But researchers have proven that children who have history of febrile, family history of febrile convulsion are more prone to having convulsion during their fever season. Now, I'll be telling us, okay, there are two types of convulsion actually. There is a simple one and there is a complex one. I will just be giving you some of the ways you can handle convulsion whenever you see a child that is jerking, twitching, or rolling the eyes and trying to battle and struggle. There are things you need to do when such incident happens. Now, the first thing you need to do is not to panic. You don't need to panic. You need to actually, you need to actually be calm. Then you support the child. You can take the child to a flat surface and you put a soft pillow on the head under the head of the child. And you also need to avoid restraining the child. Maybe while the child is jerking and struggling, you don't need to stop that child so you don't injure the child. And please do not put anything in the mouth of the child. You also need to keep the airways patent or open. You need to tilt the head of the child to one side when the child is convulsing, or maybe sometimes some children will be convulsing and vomiting at the same time. So you need to keep the airways open so that the child don't aspirate foreign objects into the lungs, which can be so dangerous and deadly. Now there is something I need to let you know. Uh, the major way high fever can actually lead to convulsion is not actually known, but researchers say that when there is a sudden increase or a sudden rise in temperature, it usually disrupts the normal electrical activity of the brain of the child. So that is what leads to that convulsion that makes the child to be coming up with jerky movement, stiffness, eyes rolling, and all that, and so on. So the first thing I said, you should be calm. You should support the child, keep the child on a flat surface, put a soft pillow under the head. Then you also avoid restraining the child. Don't stop the child from struggling so that you don't injure him or her. And don't put anything in the mouth of the child. You also need to time the seizure or the convulsion so that when you get to the hospital, the doctors could ask you how long did this convulsion last when it happened in the house. Was it 2 minutes? Was it five minutes? Was it more than that? The doctor would want to know so that it will be a baseline data on anything or any care he or she will be rendering to your child. Now, the major thing when it comes to fever is that you should prevent convulsion. It's not good that you allow a child to go into convulsion, though sometimes it could happen, maybe out of ignorance, or maybe you were not available at the moment to care for your child who is running a fever. But the best thing to do is to prevent convulsion. And how do you prevent convulsion? You need to prevent it by taking care of the fever of your child. If your child is running a fever or running a temperature, you need to provide the child with fluid, with water, clear fluids. It could help them to regulate their temperature. You could also wear them light clothing. There are some parents who don't know this. Sometimes maybe rain is falling and the child is running a fever that is above 38 degrees Celsius, and they are wearing the child a thick clothes and they are still covering the child with blanket. It is very wrong. When you cover a child that is already running a temperature, there could be a spike in the temperature which could lead to convulsion. So you need to wear the child a light cloth, provide a clear fluids like water. Then you could also tepid sponge. There is something we call tepid sponging in nursing. That is where you use a water that is not warm, not cold, not hot. You use it with flannels to clean and to rub on the body of the child, especially the foreheads, the armpits, the groin regions, and all that. It could help to regulate or to reduce the temperature a little. Then you can also give paracetamol if accordingly as advised. Maybe you need to go through the leaflets of the drug so that you would know the dosage you should be giving the child. But if you are not sure about the dosage, as you have given fluids and you have also worn the child a light cloth and you have tepid sponged, you could rush to the hospital. But if you know and you can go through the leaflets of a paracetamol, you can give your child paracetamol to avoid convulsion. Then afterwards, you should make sure you seek medical attention. Why I'm giving you this guidelines is that you need to do all this to avoid your child entering into convulsion, because convulsion is not good for your child. So you need to avoid that. Tepid sponge, give your child fluid. Then wear them light clothing when they are having a fever. You can give paracetamol as advised or as prescribed so that the temperature of the child can be put in check. So you need to do all of this for you to keep your child safe. So prevention is better than cure. You need to avoid convulsion at all costs. But in case you have a child who is convulsing, what I said earlier is what you should do. And once the convulsion has stopped, please do not conclude because the fit or the seizure has stopped that no need to go to the hospital. You still need to go to the hospital so that the doctor would ascertain the cause of that convulsion and to know if there is risk for future occurrence again. So this is the reason why you need to go to the hospital even if the convulsion has stopped. So you need to take the child to the hospital. This is what I have for us today. And the next time we are going to be meeting, we are going to be discussing another important topic that is useful to everyone, both young and old. Please stay tuned to my channel. Share my videos, like my videos, and also subscribe to my channel for more health talks. Thank you for listening. Bye bye.